Hi everyone, Nigel here from Hand Pain No More. Today I'm going to share with you about this condition called jam finger. It's a really unfortunately common condition. So what happens is that it's called jam finger, right? And the reason why it's called jam finger is because it happens because people jam their finger into things. The most of the time it's due to sports. For example, when you play rugby, you play soccer, you play basketball, and the ball comes to your hand, and then you want to save it or you want to catch it, and what happens is that the ball hits the finger, right? Like see example of this picture over here, you can see the ring finger is pretty swollen over here, right? Likely the ball hit the person on the finger, and then it move this joint. So this joint, this joint over here, this one here, it probably either move up, down, left, or right with too much force, because in some structures there are micro tears or micro damage, right? And that's why this swelling, immediate pain. So what do you got to do when you get a jam finger? So with every patient that I get, everybody that I meet, the first thing you got to do is ice. You always ice it. As long as there's no broken skin, as long as no big abrasion, bleeding, just ice it. You can use an ice pack, you can use a cold pack. If you have more sensitivity to cold, you can put a layer of towel first. So what the towel does that it will gradually transfer the cold, but it's not so direct, it's a bit indirect. This prevents patients from getting superficial frostbite, which can happen. So I sit for every hourly for about 10 minutes. So 10 minutes rest, 1 hour, 10 minutes rest, 1 hour. Then after that, day one, day two onwards, you can do it once every 2, 3 hours. Up to you, depends on you. So ice is to bring down the swelling, bring down the pain, and after icing it, you protect it. So for some patients, what they like is that they either get a splint. I can show you a link to a splint below. But if you have an ice cream stick, or sometimes you don't have ice cream stick, you got like a pencil. You can just take a pencil, right, and put onto your finger this way. Can you see, like this? And then you just tape it around the joints and make sure that it's not hurting you anywhere. This will just provide stability and protection, so that if anything pushes it, there's something to hold it in place. It's like a guard, right? But it's more comfortable to wear than guard at this point in time. That's to protect it. Of course, for you with the injury of a jam finger, I don't recommend you to use your finger for now to carry weights or do anything. Just protect it and rest it first. Then after that, you got to elevate it. Elevate, you can just put your hand up this way. This make sure that the gravity pulls the swelling down away from the finger. You can see the finger over here is a bit swollen. Okay, when there's injury, there's always swelling because the body notices that there's an injury there. It will send repair cells to repair the site, and this comes with a lot of fluid. So this is going to look and feel like a swollen sausage. That's why we term it's quite swollen up, right? So it's kind of uncomfortable. And then that's for elevation. So elevation, you can rest your hand this way, just on the table, or to watch a show. If the pain is not so bad, you have to check in on your pain. What you can do is you can take off the protection for a while, and then you can do gentle flexion extension. If there's no sharp pain, you continue. You should be feeling more achy, kind of like a stiff kind of pain or discomfort. But if there's nothing more than that, you can continue. Don't do too much. Maybe mobilize it or move your fingers maybe an hour. Every hour, do it for 5 minutes, 10 minutes. This will just prevent stiffness from setting too much. And then item number 4, you got to do a pain check, right? So with all mild conditions, most jam fingers are really mild. They don't need any intervention other than a splint or some painkillers. And you may not even need painkillers. So normally for mild cases, what happens is that pain is the most intense on the first day, then pain drops down every day. Every time as it heals, the pain goes down and down and down. By day 10, day 15, day 14, the pain should have dropped more than 50 to 80%. With lingering just pain, with aching pain or pain is suddenly bump into things, that's fine, that's normal. What I want you to look out for is if there's pain that is not going down. That means that the pain from the moment of injury is the same pain on day 1, day 2, day 3, and onwards. That signifies or signals that there might be more injuries than we thought. It might be a tendon injury. It could be a ligamental injury. It could be a bone injury, right? So if your pain doesn't go down by day 3, it may not be such a simple jam finger after all. Then if that's the case, go down to your local emergency department or A&E department and get it assessed, get it sorted out. You can also go and see a hand therapist like us. You can go to your hand therapy department. You can go to an orthopedic doctor. Just check it out. Just sort out if there's anything more severe or not. Because pain would go down day by day, really quite rapidly. So to recap, jam fingers are really normal. You get it by jamming a finger into things. People in sports, they get it because balls hit their hand or opponents bump into their hand or their fingers. For regular day-to-day people, you can get it by missing a step, slamming a finger against the wall. You can do it while you're cooking. If in car, miscalculate the distance when you want to reach out for something, and it's a really common condition. This jam finger. So remember what you do, you got to do immediately, you got to ice it as fast as you can. Okay, ice it every hourly to bring down the pain, to bring down the swelling. You got to protect it. You protect it by wearing a splint. You can buy it in a pharmacy, or if you have tape at home, you can just use a pencil to tape the painful finger together. You got to elevate it. Number 3, elevate it as you watch your shows or as you are traveling. No, don't do it when you're traveling. People look at you like you're weird, right? So as you're resting, just elevate it. If there's no sharp pain, you can take off the splint and then you can do gentle flexion and extension. If there's no sharp pain, this will make sure that it doesn't get too stiff, right? And number 4, you must constantly do a pain check. The pain must keep going down. That means the pain gets better. It doesn't get worse. Every day, the pain should be dropping a little bit. Okay. Ideally, by day 14, day 15, the pain goes away entirely. But some patients, pain levels are different. Some of them get pain that lasts longer. Some pain lasts shorter. But most importantly, the pain must improve. That's a normal progression. What's not normal that you need to look out for is that pain that doesn't improve. The pain intensity that either is the same or keeps going up. If the pain in your jam finger keeps going up, then it's a possibility there's more injuries than just a simple sprain. It could be ligamental or tendon or bony issue. So if the pain keeps going up from day 1, you should go and check in with your orthopedic doctor, your hand therapist, or just walk into your accident emergency department, right? Get it checked out, get it sorted out. Most of these jam fingers are really easy to settle anyway. So if you have any questions, just comment down below. Just reach out to me. I'll be more than happy to help you. Take care, guys. See you. Bye.